For the overview of issue, Hartal Doctor Contract is a worker strike that conducted by Malaysian medical officer on 26 July 2021. The main problem that have been raised regarding to this policy determines what happened to medical officer after their contracts expire, as there is no clear policy regarding the absorption of contract medical officer into the permanent post. Minister of Health stated that just about 3% officer were effectively allocated as permanent medical officer in May 2021. Several issues were raised because of low wages, problem with the leave and opportunity to become specialized in the future. Dr. Adham Baber declared that no action will be taken against the doctor who joined the strike. Before the strike happened, they used social media to spread awareness about the contract doctor. They used the hashtag Hartal Doctor Contract and post it on social media.
Okay, so what is the most related theory regarding this issue is I think Herzberg two-factor theory, also known as the two-factor theory, because it is content that organization can impact the motivation in the workplace by adjusting two components, motivators and hygiene, where motivators might urge employees to work harder. Hygiene, on the other hand, will not encourage employees to work harder but will cause them to get discouraged if they are absent. So the hygiene factor is the most accurate since absence of hygiene aspects causes employees to work less hard. Hygiene variables do not exist in the job itself, but they do exist in the environment. So hygiene factors include the company policies, supervision, relationship, work condition, status, pay and salary, which is the most related regarding this issue, and then security and status.
According to Herzberg two-factor theory, a person's motivation can be influenced by two elements, factors of hygiene and factors of satisfaction. The term hygiene needs refer to a person's fundamental requirements such as pay, job stability and other things. Due to pandemic COVID-19, Malaysian Ministry of Health took an initiative to hire a large number of additional employees. In these issues, one of the most important conditions for hygiene element, and that is the employment security, has been broken. The salary paid to these contract doctors is the second issue that is in the violation of the standard of hygiene. In this scenario, a contract doctor remuneration is much lower than a permanent doctor. This matter is also caused by the lack of analysis in the particular job. Herzberg two-factor theory is very closely connected to the Hartal Doctor Contract issues. We can find the best solution to this problem by comprehending this concept. It can be a burden to our country if our frontliners cannot perform their job well because of these administrative issues.
There are several suggested solutions in order to solve this issue. The first one is to enhance the skill set. Since a permanent position in a public hospital is still uncertain, contract doctors could think of continuing their service in private hospital. Second one is equal pay practice. This eliminates the risk of paying anyone less than they deserve. Next is to revise benefits for healthcare contract worker. Every personnel deserves childcare leave if any emergency occurs. Next is clarify job categorization. The complexity of the work and the extent of the worker flexibility should be reflected in a job categorization. Reclassify contract title. Last is collaboration between government and the medical institution. It is better if the criteria were introduced to the students during their study period, as they could grasp it better and perceive fairness.
In conclusion, there are a variety of things that may be done to keep employees engaged in their profession. A person's motivations consists of three components, which is identifying what is important to them, offering it in exchange for something else, and engaging in the desired behavior. The two-factor theory developed by Herzberg proposes that two factors of hygiene and satisfaction, can influence a person's motivations. Employee satisfaction and retention have long been recognized as significant difficulties in the medical field. According to the issue discussed, which is the contract system, contract renewals are not automatically given based on service years or even merit, which is a fault in the system that has to be remedied. So, contract doctors are terrified of the prospect of being dismissed at the conclusions of their contract, even though they have spent years learning their professions and completing mandated training courses. These individuals' extraordinary effort as Malaysians' most visible frontline combatants in the fight against COVID-19 must be recognized and compensated in a fair and equitable manner. As a result, it may aid in increasing job motivation and stability for this profession, which will improve the image of this profession as well as the overall quality of the Malaysian healthcare system.